Hi, you might be watching this video because you are going to have a neurodevelopmental assessment. As part of that assessment, you may need come in for an extra assessment of your language and communication skills. Along with other information, the assessments will help us to see if you might have developmental language disorder, which is a condition where someone finds it tricky to understand or use words and sentences in the same way as everyone else. You will receive a letter with the date, time, and location of your appointment. When you get here, you'll take a seat in the waiting room where you can get a drink and play with some toys or do some colouring if you want. Then, someone called a clinician, who is a person that works here, will come over to you and your parents or carers and take you into one of the clinic rooms to explain what you're going to be doing. Your parents or carers can come into the room with you, but will have to go back to the waiting room when it is time to do the assessment. The assessments explore your receptive and expressive language skills. Receptive language means the words you understand, and expressive language is the words you say. Once the clinician has finished explaining the assessment to you, it is time for your parents to go back to the waiting room so that they don't distract you during the assessment. Then, you will do the activities. These will involve answering some picture-based questions, telling some stories, and answering some questions. After you finish, the clinician will have a chat with you about what you find easy and what you find hard. You won't be able to get the results straight away, as they need to be reviewed as part of your whole neurodevelopmental assessment. The clinician will make sure you are okay after completing the test and take you back to the waiting room, where your parents, carers will be waiting for you. The appointment will probably take about an hour and then you can go home.